actually this a bit. It's sorry. Now we will start the live injection and full face transformation by using Aliaxin. I'm to the very hard cases, but I want to show you how we can lift a very sagging skin and very sagging face. Even she is little bit have a good volume and no volume on her face. We will try to give her the maximum lifting without big volumization. Now, as we tell and we explained before, we need to start our case by study for the face. Good study for the face and preparing for the priority for the points of injection. For this patient, if we want to study her face, we need to check which is the most important area to inject or to start with the injection with it. Sure, for the points, for lifting points 1, 2, 3, we need to do it. And as I explained to you, if you move the skin like this one and you feel you can't move it, you can go for fan technique by cannula under the hairline to lift this area very well. And also for the jaw, you see this dropping here, and which is too much common. And a lot of ladies suffering from this one and need to prepare this one. How we can improve this one? We can also preparing her jawline by a good way and the marionette line here sure, preparing good projection for the chin, and sure we need to fix the nasolabial fold because it's too much deep on her face. In this time, she will get better look and we will lift the face up. By all of these points, we will help him to lift the face up. For me, the main important problem for her, the chin. I will give good amount injection for the chin and give good projection for the chin to improve more and more the look. Okay, we will start now. As we explained before the lunch, we explained that the mid face is the most important area I should start to fix it and prepare, because when you inject well the mid face here and you lift up the cheeks, a lot of problem around this area on the face will improve directly. When you lift the mid face, when you lift the cheeks, the jowl is coming better, the nasolabial folds and the marionette line is come better. So no need to use a lot of product in this area, and we can keep our product to lifting the face, and in the same time, not just for saving the product, but we didn't put our patients take a look and don't use that much amount from the filler. We need to use always the minimum, best result with the minimum amount of the fillers. Actually, I need now Aliaxin SV. I will start with the cheeks. We should keep in our mind, number 3 here, 2, 1. 2 and 1, we can inject by needle, because here in the zygomatic arch, we can go deep to the bone and inject by the needle, and it's safe. Better we aspirate, no problem, but it's safe area. For number 3 here, you cannot inject by needle because we have hole in the bone and there are vessels here. So we will inject this area by using cannula. For the fan technique here under the hairline to lift the face up, we will go again for cannula and superficial injection. I mean by superficial injection, direct under the skin. Direct under the skin, not in the skin. Direct under the skin. So I will start by Aliaxin SV using needle. I will prepare 2 points. One, I'm going directly touching the bone under the muscles. Very deep. I'm really touching the bone now, and you can feel that easily, sure. I will put 0.3 in this point. to lift up the cheeks, and I will complete here with a high point. Also, I'm in the bone, I'm touching the bone. I will put 0.2. Not to give big amount here, to didn't give her too much projection for the diaphragmatic arch. It's not with natural look. Now I give lift up for the number 2 and 1. And I will change to the cannula now and go to fix number 3. Give me the cannula, please. Try to count with me. We use 0.5 now, and I will inject here. 0.5 mostly, but always your eyes see what happens. If I feel I'm enough with 0.3, I will stop. No rule. Don't study points and amounts. No rule. Depends on the case in front of us. We are seeing what happened. We are lucky. The filler directly give us the results. Directly we can see what happened. So we can stop with the point we feel it's enough. I will go with the entry point here. Again, they ask me now for the lunch, they ask me which is the entry point. No true entry point and no wrong entry point. Go from where you want, all of true, but arrive to your target. Now I will inject here. I try to catch the fat. I will go under the fat, deep, not superficial, like this one. You can see when I elevate the fat, I'm now under the fat, not very superficial. And I try to manage the top of my cannula by my another finger to feel where I am and to inject by nice way and smooth look. Separate your product. Change the direction of my cannula, and I feel well this. Sometimes in the same entry point, I keep now 0.1. I lift and I change the direction of my cannula to go again, not very deep, to complete my arch here. And also that's one more smooth look for the final cheeks. Now I apply here apply 1 ml, 0.4, 0.1 by cannula, and 0.3, 0.2. The full amount is 1 ml for these cheeks. So this in front of the camera, like this. You can feel we start to get lifting for the cheeks and it's too much feel. Now again, Aliaxin SB by cannula. I will go to lift this area by fine technique under the hairline. Now, the entry point here, try to choose entry point not too much sharp to let you arrive to the hairline. Now I will enter here. Again, a little bit. Now, we are trying to complete the arch. Playing with your cannula to continue the arch. See where I am. Okay, I will lift a little bit my cannula to let you check where I am. Okay, I'm under the hairline. I'm trying to complete the arch. Please smoothly move. Don't inject full of technique. We are injecting by technique. So smoothly move your cannula. Don't use big amounts and try to change the direction of your cannula to don't stay in the same line. Sure, in some places you feel resistance, which is normal. Yeah, perfect. You will see now how this area affecting the lifting look for the face and how it's helping to lift. Okay, I finish 0.5. Okay. Now we almost finished the first cheeks and we prepare good lifting for the middle face, and you can see direct the results, how it's look. See with the camera, maybe. Okay. See the big difference between the sides I treated and the other one, which I don't treat, use 1.5 in these sides. Again, I will give you the points. We inject on the bone, number 1 and 2 on the bone, and go with cannula for number 3, feel this area, and we go under the hairline with the cannula to inject to complete the arch and to inject under the hairline to give more lifting look for the face. See how much difference between, really the light is too much, but you can feel how much it's look better between the two sides. Now, if I will go to prepare more lifting, I will do the jawline here. I will inject the corner of the jaw, and I will do the chin with the marionette line. Then, at the end, I will do the nasolabial fold. So, we will go for here. Here, we have two very important also to inject. We will inject deep on the bone, willows technique, in the corner exactly, to give the shape. Because see here how it's depressed already and no fat here. Then, by cannula, I again put my cannula here and I don't go under the muscles. I go under the skin directly and injecting by little bit fan technique to make smoother look and to make soft look. Because if you just put a bullous here, it will not look natural. So you should play again with the cannula for that jawline. And this by needle and keep this one by cannula, please, because we will use it. Now, when I want to inject the corner of the jawline, let the patient little bit give you head up. I will turn it little bit for the side to let you check. Let it turn it up and go by your hand, check where is the corner exactly. To give her good look, you should imagine you need this result. Where my finger exactly. You need this result. So to exactly get your point, like check where is really the bone for this patient, and see here our patients, especially our case, have a volume here. So take care. Don't inject too much back because she is already have the big muscles here. So I should follow him to present here and I will inject here exactly. So I go to inject in the corner. You can check. I'm in the bone. It's a safety area to inject directly because in the bone should not have any vessels here. Because she has good depression, I put for her 0.5. Now, with a cannula, actually, the other 0.5. Now, I give her bolus technique here, and it's under the muscles on the bone, but I will put my cannula here to make a smoothing look for all of this area to give good defining for the jaw. So, we will go again to keep entry points. You know here the facial nerve, the facial artery, it's go a little bit superficial. So if you inject this area, you should inject by cannula. I will come here, you can see where's my cannula, exactly where I want to, in the jawline. Don't go back because she is already have volume here, so I will little bit avoid this volume. I will start in front of him and I will inject very slowly and return back up in one point and little bit. I improve all the jaw. This one. Now I try to make smooth look for this area to give well defining for the jawline. I try to go out, check my pen, to check where I need to inject and to give smooth look. I will go again with the same entry point. I'm injecting here. You see how we avoid this jaw which is sagging here? Should I start directly back of it? Because if I inject here, I will give her more sagging look. So to prepare well defining for jawline, you should avoid to inject here because I will try to lift this area by injecting here and injecting the chin. Now, you can see it's thick. It would without volumizing, but it's good defined. Now, give me this one, change 0. Aliaxin EV by cannula. Why I use here Aliaxin EV? As I explained to you before, for the nasolabial fold and for the marionette line, we are not injecting so deep because we don't want volumizing in this area, just we want to remove the line. When I want to remove the line, better if I go for essential volume, Aliaxin EV, not SV. Super volume when I want to make projection, when I want to inject on the bones. Now, for the marionette line, it's very important point. Please, give me a marker. No. With Ashley? My phone. Okay. For the marionette line, please draw the marionette line here. See where is it, and avoid to inject after it, because again you will give sagging look for the patient, and for me it is from here to here, not allowed to inject in any case. Because if your patient today don't have sagging, on future she will have it, because all of us sagging from this area, so don't inject this area, not now, not later, don't inject. So in the marionette line, we will avoid to inject after this line, and we will inject just before it. With the Aliaxin EV, I will make my entry point. I will try to inject with the same entry point. That's much closing. Okay. I try to give space for camera. Now, make your head up, please. Why I make the head for the patient up? Because my hand need to have space here. Because I will inject superficial, so we will start to make hand technique. Keep superficial, please, don't go deep, because you will inject in the mucosa and the patient will feel lumpy inside her mouth, but no result outside, okay? She will feel something inside her mouth, like a lump, and she will not find good look for the skin. So I will start. See where I am. You can see where my cannula, even it's in the corner of the mouth. This is lifted the corner of the mouth and give the patient like a happy look, not a sad look. We will improve this one smoothly. Always the injection with the fan technique should be smoothly as you can. I finish, I arrive to the You might change the direction of your cannula well. Please be sure you have a good, again, don't inject too much under the mouth, but here, just to give a small look. Again. And the last line, this one, for the chin. It's too much preparing good look for chin if you go for this direction and inject well here. You will find very big difference for the shape of the chin by this injection. Try to fix the end of your cannula. Please, your concentration always with the end of the cannula. End of the cannula will stop in the good place, where you want, on your target. Okay. I complete my fan technique in the same area. I will go again up, please. Now, again, I will arrive here to inject a little bit more. I finish 1 ml Aliaxin EV for this area because she has really sagging look from the marionette line. Okay. Now, it's clear that we get a very nice result for her marionette line and the big difference between the treated side and not treated side. And this one, how we will complete this one, see here and see this line here. The line here, how it's deep and how it's lifted. What will complete this point? The injection of the nasolabial fold. Aliaxin EV with the cannula. And even when you inject the lips filler for old people, when you lift this one, it will be more lifting for the base. So even sometimes I tell my patient, I will gift you at the end of our treatment, very little touch for it. No, I don't want it. They're thinking lips it's over for old people. I promise her it's very simple touch, but it will add something very beautiful, and I will gift you this touch because I don't finish full face lifting without touch for filler. Touch of filler, hydrating filler, and lifting the corner of the lips and complete the lifting look for full face. I will not put here big amount from product. I don't like to feel too much nasolabial fold. I prefer to be very natural for this one because it's not beautiful to give a more amount of filler here. So see where I am. I'm really superficial, not very deep. I'm under the skin directly in the superficial layer of fat, and I try to inject not with a sausage loop. I give moving, keep moving to give natural look and good feeling without any plumbing. Now, perfect. Okay, perfect result. Check, please. You can see the big difference between the two sides, how we are making lifting, but no volume. Even if you're comparing the side where I inject and the other side, it's really look lifted, but without volume. I'm not finished. I can do another very beautiful touch for her face to look more lifted when I concentrate more on the chin. Chin, I inject now 1 ml for marionette line, but not for chin itself, but I will enhance the chin to look more lifted for her face. So how we enhancing the chin more and more? We have two steps. One of them, deep injection on the bone, directly in the middle, because you know we have here the little bit sides you are under risk because there are also this hole, and we have these vessels here. So in the middle, exactly in the middle, it's a little bit safe area. We will aspirate anyway, because it still sometimes has different between people, so it's not 100 safe, but almost safe. Dip on the bone here to give a little bit projection for the chin. Ashley, Aliaxin SD by needle. Yes. I will inject anyway, even now, because it's helping with the lifting. Because this is the point number 8 we explained now in the literature. This one I'm not finished. I will inject it because really it's improved. But for her especially, will avoid the backside because she has here a big muscles here. She should avoid this area because it will give her wide look. But it's very important when we inject this area to give more lifting, and it's a very important lifting point. Okay. For the chin, dip to the bone, I will go to inject from here, very deep. I'm touching the bone now, but I will aspirate for usually 30 seconds. Wait and inject. Put your finger here also to avoid the migration of the filler. And to control more the beautiful shape for injection. .5. Sure, it's a little bit a hard product. It's not soft, but it's gives good protection and good result directly. She have a dimple in her chin. Some people, if they want to keep the dimple, we are not injecting this point. We are injecting just with the cannula for the sides. It's painful area, sorry. Now, Aliaxin, leave you with the cannula, please. Whatever. Now, to give more lifting, as Dr. Tell, we will inject a little bit here to give more lifting look for the face. This one, and I want to show you also this point, by cannula, you can also make fan technique. It will help to lifting this area, but in this case, should not be too much deep. Also, you should under the skin directly and injecting with a fan technique to give more lifting. I choose the entry point, allow me to arrive where I want easily. So no problem for the entry point, where you want, just your target should. Not more than 0.5 to didn't give her like volume for this area. Now it's helping more and more to improve this here. You can see her neck and her jawline, how much it improved. Now, little bit down. It's clear how the face is lift up and give lifting look, and she has better look here. But for me, I want to add a little bit here and here. I want more to give more good shape for the chin. because her chin is important to improve more and more. See where I decide to add. When I find shadow, this depends on the shadow. Little bit there are still shadow here. If I fix it, she will look better. And little bit the corner of the mouth, I can give more lifting. So I will try again to give her small amount from the Aliaxin EV in this area to give more lift. As we explained, you see the result directly. So add, put your touches. Be careful, step by step, and look, when you find yourself you need a little bit to add more, you can add it easily. I think I can go from the entry point. See this shadow here, which I see, I can also give little amount to improve this area more and more. And the corner of the mouth here, little bit, the head has I try again to manage the corner more because it should look better. Very superficial, I'm not deep at all. And I support this area well to give lifting look for the corner of the mouth. Now, better now. Now we will transfer to the other side. Really, you can see how much you get good results. I want you to see the result immediately here. You can turn, please. You can see the look of the lifting, how we lift the face and we make the lines less. See here, see the big sagging here, and here the marionette line, how it's, and see that even the irregularity in her chin, how it's fixed well and give her lifted look. Okay. We will start by the other side to repeat again the steps. Aliaxin SV with the needle, 0.5, okay. Aliaxin SV with the needle. We will go deep on the bone. I'm lifting a little bit the muscles. I go deep, 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 touching the bone. I'm now in the bone. Look at if you are straight, constant. 0.3. No rule. What you see is suitable, you should stop when you feel it's okay. 0.2. But again, if you have good projection for the diaphragmatic arch, don't add this projection too much because it's not beautiful looking. Okay, now Aliaxin SV with the cannula. As we explained, start with the mid-face, fix the mid-face, transfer to the jawline, chin, marionette line, last things, then nasolabial fold. Like cannula, I go to inject number 3 points. Lift the fat department by your hand. See where is my cannula, you can see now. I try to improve even this area by starting injection at the highest point on the cheeks. Keep deep, please. Don't be superficial in this area. Because here you have good fat department. You should hide your filler under it to give more smooth look and more natural look. And sometimes if your patient have a little bit asymmetry between two sides, you should follow what you see. You should not inject the same amount in each side if you don't have symmetrical face. Open your eyes, please. Have the headache. No need to keep this one too much high. And as I do in the other side, I change the direction of my cannula. I prefer to go for the other side. Ashley, come please. Catch this one. Just catch it. Okay. Usually with the cannula from the right side, it's more easy to inject. Now, I go again from this one. I add 0.2 just to make sure everything is smooth and look perfectly. Okay, now I will go again from another entry point to make the lifting fan technique under the hairline. Okay. Now I'm under the hairline, you can see. Smoothing movement, please, as you can, try to be very natural. See how I lift up the cheeks by this injection. Perfect. Okay. We lift the cheeks very well. She has a very nice result. Now Aliaxin SB by needle to inject the corner of the jawline. Maybe from here it's more easy for you to see. How I will know where I should inject, you can see the sagging here. I should avoid this area. I can inject after this one and before this one to improve this. So we will inject in the corner. Please, by your finger, touch the bone. See where is the corner, the real corner for hair. Where is the corner of the bone? Because we should follow her face. So here I can know where is the corner for her face. She has volume here, so avoid more than anyone to inject a little bit back. See the corner, how it's clear. This is my target at least, and this is my target. What I want. So I will start by the point, which is my target, with a needle. SB with a needle. Why I'm using SB? Because it's super volume. It's a thick product. I need to inject on the bone. So I want a very thick product to inject on the bone. Because she has a good depression, I give her 0.1. Usually I give 0.2, 0.3, but little bit, our bullet today, little bit old. When I make the corner, I again go for cannula. But I want to ask you something. Why I don't go here and inject also by needle? Because you know, in front of the muscular hair, we have the facial artery, and it's so risky if you want to go deep by needle in the frontal edge of the muscular. With a cannula, again for cannula from the right side, it's better. See, again, what our target? You see the depression here? I want to fill this one and give more defining and smooth look for the jawline. So I will go with the entry point in front of this. Head down. Please. More. Yes, exactly. Okay. Now Again, put your target. I want to give her this defining. By candida as you can, move by fan technique to give a smooth look. I need a little more. She has a good depression here, so I should a little bit add more for her in this area. But don't use needle anyhow in this area because it's high risk, and we should go for candida. Just candida. By candida, you can arrive where you want. Just move your candida for any direction you need, and see now it's good, but we need to complete our treatment here because she has a good jawline now, but we need to complete our treatment by improving the chin to give the final result for the jawline. So we will go for Aliaxin EV. Cannula, please. Change this one. Okay. You see, that's meaning if you want to improve this jowl, you can inject just the jawline. You should also enhance that chin to get the final result. Because really, as much you are injecting well here and you give good defining for them, the jawline, still we have little sagging here. We should complete by enhancing the chin to give the maximum lifting effect. I don't choose today easy case to let you check what the meaning of real lifting. Because if we bring a young people with little bit loss of volume and add for them filler, sure we will get lifting effect. It's easy. Little up, please have me raise it up. Again, head up to take space for my hand to keep superficial. Keep superficial. And you should be in good improvement. Again, yes. Exactly. You can see where I am now. Okay. We are superficial injecting the corner of the mouth and the marionette line. And please don't pass the marionette line because you will give more sagging look. So don't be back of the marionette line. Again, you can see I'm in the corner of the mouth, lifting it. Again, I change the direction of my cannula to enhance any depression in the chin. I'm playing with it like you are drawing. You should not put in a bolus technique. You are playing. You see where is the depression. You give little bit more amount in the depression just to give very beautiful look, and your eyes already watching what happened. More Aliaxin because if you remember, I add 0.5 more to enhance more the corner of the mouth. And already, yes, and already when I will inject the nasolabial fold, see the nasolabial fold, how much it's good technique to inject it superficial by cannula, easy, safety, effective, and really give lifting look, but without changing the features of the face. Patient usually, if you inject, I don't like this deep on the bone. It's suitable for some rare cases if they have loss of volume too much here. Okay, 1, 2 point deep on the bone here. It's safe and okay, make projection here, but the projection here is in general not beautiful touch. Not the face beautiful touch. You can see how much the bruising is with the minimum. Not that much bleeding. Play with the same entry point and make yourself use about that safety entry point for your cannula, and you will keep your patient happy from the result in the same day. No need to suffering from a lot of bruising, continue for 1 week, sometimes 10 days. I'm trying to remove my hand to let you check what happened. What we do by needle in the middle of the chin, it's working for both sides because I put it in the middle. But when you are injecting the EV to improve the chin, you should superficial injection, that's meaning under the skin up to the muscles, you should prepare from each side. Big change in her chin, and it will make a big change on her face in general. Because really, when you enhance the chin look, the face all changing. Aliaxin EV by cannula, I will lift that. Now, when I finish the chin and the marginate line, you can see how the jawline and the sagging here, how it's look much, much better. When you complete your work before and after this job, how it's improved. Before the lunch, I tell you, usually I not tell my patient, oh, you need that amount from her to do. But just the patient asking me, full facelifting, I tell this one. We need 10 ml, 10 ml. I cannot do by 2 ml. I cannot do by 3 ml. I can prepare one area. I can improve this area, but full facelifting, I need. I study the case. I need like almost 1 ml here, 1 ml here, 1 ml. That's meaning I need, for example, 6 ml, 7 ml, 8, 10 ml. We should respect the amount. In one training, someone tell me these sentences, and I keep it in my mind from this day. Respect the amount. If you want to do something by very simple amount, you will not have a result. Depends on the case, depends on what you want and what you target. If you want to make full facelifting for an old patient, very sagging skin, you should have a good amount from the filler. Otherwise, you will not have a result. I can prepare one area by less amount, but I cannot make full facelifting. Now, Aliaxin EV again with an nasolabial fold. See if we go from entry point here. Not so deep, please. I'm superficial. My target, the line itself, not the volumizing of this area. And I start from the beginning. I inject, I move, try as I can to give smooth look. You can see also that I avoid the third part, the lower third. You notice that? Why? Because if you inject the lower third of the nasolabial fold, logically, you will give like a volume here. Even when she is smiling, have a line, but when without the smile, maybe she will have a little bit volume here. Even with the superficial injection, but little bit volume here. And volume here will make sagging look for the corner of the mouth. So no need to inject the third part of the nasolabial fold. This one, if you correct the marionette line and correct the two higher thirds, it's enough. And this little bit, even she have it, it will look like smiling look. It will not sagging. So better if you keep it. Even she have better if you keep it. But usually when you treat the marionette and the two higher flare, you'll get very nice results. I want to do this one. It will improve a lot. Also by facelifting from the mid face, it will give a very good result. I check again what happened here. I little bit more here. You can see little bit here more and more than because even on the other side we are using 0.5, so I want when the patient has a very old and deep lines, you know, it's making like creasing in the skin, and it will not left directly, but you at least your patient after 1-2 weeks, it will improve a lot. Pause, please. And the last Aliaxin, EP with a cannula. The last area I want to do also this square. If it's in your clinic, also you will give botulinum toxin. Entry point. Not very deep. As you can give a very smooth look. Complete your job up and down by give smoothing look for this area. I avoid to inject backside too much. Why? Because she have a little bit wide from here, big muscles. We are not to this point for all people, huh? If they need it, we will do it. If not, okay. Again here, I feel I need a little bit touch here, little bit head up. Okay. Little up. Totally how many ml we use actually? 6 ml totally. Good. Now for lips. Yeah. You can see how much improved in this one, how the sagging look for the face is improved, how the cheeks is coming up. Make the head now, head down, please. So you can show us the hair photo before. That's much. Little up for the camera. Okay. You can show us the hair photo before. Now, again, remember. Okay. Usually, when you are injecting filler in a true way and a good tip, no need to massage. But if you find yourself need to make remodeling for some places, no problem. You can massage the filler easily, but if you inject it by smooth look, no need even to massage. For the lips, the most important, the layer where you injecting the lips. If you inject under the muscles, you will find the projection and that look. Now all of the work go for injection submucosa. When you inject submucosa, even it's a little bit hard to control exactly the amount and the smoothing look for your hand while you are injecting. You didn't give a plump look, but it's the most beautiful way to inject the lips when you inject it under the mucosa and for safety. Because also in the muscles there are the vessels. Submucosa, no vessels. If you want to be safe, no occlusion, you should inject under the mucosa, and but you should keep your hand smoothing injection to didn't have lumping. And what usually I do for that, Aliaxin is it. Aliaxin LV is perfect product, but I change the needle for the smaller one, for the 29 gauge. I don't use a 27. Okay, it's make a little bit harder for my hand to inject by 29 gauge, but you will control more. You will give small amount. The products will not lose from your hand. So don't giving a plumpy look for the lips or plump hump and plump in the lips itself. You go for 29 gauge, same needle for profile. Now, if we want to make the lips like closer, try to inject by this way for the upper lips and by this way for the lower lips. It will give you like small mouth but plumpy mouth. So I inject under the mucosa from here, the top of the pyramids here. I arrive to the end point down to give lift up, and I start to inject slowly. Don't inject too much. Be smooth as you can to give very perfect result. Now I arrive to the top. I change the direction of my needle. I want to tell very important things. If you want to stay in the same depth, don't move this hand. The hand which is catching the needle, don't move. Move this. Move the lips on the needle. I start by suitable depth, but I'm sliding the skin on my needle. I don't move my needle because sharp needle, if you want to push, you will go maybe up, maybe down. So put the top of the needle in the right depth, then sliding the skin on the needle. And this time, imagine you put pin with elastic and you want to put in that. If you move the pin, you will go maybe up and down. But usually you put the pin and slide that clothes on that one, and it will easily go inside with the same depth. You will not go up and down. So I inject from the top of, okay, you cannot see well, like this one. You can see how we lift up the lips. Now, if I want to continue, lift it up, no problem, I will manage myself. Okay. If you want to continue, the second point, I speak a little bit deeply, but to give you the most important technique. Second one, don't go after the skin. It doesn't give like this look. Second point, first point, at the top of the pyramid, at the top of the triangle, you can go a little bit up to lift. Second one, don't go. You didn't give like this one. Go in the pinkish line of the lips. So see the second point where I will choose it. Second point inside the pinkish. You can get. Now I sliding the mucosa on my needle and injecting very slowly. Don't inject too much. If you want to give it more smaller look, don't inject this one. Keep just injection from the top of the pyramid. Now let them check this. You see how we lifted this one? And I will continue the same side down to see the difference between left hand side and the right side. But for down, from up, we inject like this one. From down, we inject like this. From middle to the lateral. Okay? Give like a smaller shape for the mouth, but lumbar. Again, go for good depth and slide the skin on your needle. Don't push your needle to the left. Change the depth of your needle. Is it clear? You know how much inject totally? Now 0.3. Now, see, again, if I stop on this one, I will give too much small look. But because he has sagging here, a little bit, if I support the corner, I will give also lift up for the corner of the mouth. So no problem for the lower lips if you support little bit the corner. See the difference between the side where we inject and the side not injection. Again, with the lateral one, don't go with the white line, go direct to the pinkish line of the inside the pinkish line of the lips. A little bit supported for this area. Give support for the corner of the mouth. Oh, perfect. I will complete the other side. Lift it up. Again, I go from upper points of the pyramids and I'm sliding. No problem if you find yourself in not too lighter, turn back, again fix your layer because the thick on the lips, the layer where you apply your material, you didn't give half at the front and two. The other injection inside the mouth and little amount. The maximum amount you put it in the middle of the lips. Don't put in the side of the lips big amount from the filler. Try to concentrate on the middle, fix the middle, then give some touches in the border if you want to add. And in young people, sometimes you don't add in the border. No need. It's already her lips is lifted and no need to add this one. There are one things I want you to fix it. Well, how we can actually make the bed up to let them see this point. When you go inside the lips and lift little bit your hands, especially the down, like this one. When you make this movement, you will little bit lift it up and give more beautiful shape. Don't inject straight. When you are injecting, make like this one, it will lift it. Like you are, especially when you have a very, very small lips and you want to create lips. Some people know lips. They can do lump, but no lips. You want to add lips. So really you are lifting the area and you get like from the mucosa inside the mouth, you are getting little bit up and one day by day, time by time, she come back to you injecting. What you do? She will again have lips. Here, see, I enter, I slide in the skin. Now, we are injecting, if we do like this one, see this movement, like this one, I will lifting more the lips up. I will support little bit the corner from inside, just because you have sagging. Yeah, just okay. Now we are finished. You can see how she look young and how she have now face lifted, no sagging look, no nasolabial fold, no marionette line. See the chin and the marionette line. You remember her before? I can't show you now my mobile phone before because I have her photo. And see the marionette line, how it's prepared well and how it's really the maximum result. You can see it in her face because, as I explained when I start, she has already good cheeks. We are not depending on adding volume on her cheeks, but we are really preparing this area too much, and this is her main problem. And see how much beautiful lips with the marionette line, with the nasolabial fold, and already natural lips. And see this sagging here, which you are watching before. See how it's almost disappeared. 6 ml, including the lips, 7. Oh, totally 11. Totally 11. 6 EP, 5 X. Totally 11 ml. Cheap. We have now cases for Profilo. We will inject Profilo with the hybrid booster. Why we are, call the other patient, please, Ashley. Name Arij. And go with the patient, please, to apply Facelift. حبيبي شكرا لك. أهلا وسهلا حبيبة قلبي بطمن عليكي. نتواصل. Usually when I do any patient to the workshop, I tell them to come back after 1 week. I check my results, I take the photo after, and I make my report. Because sometimes you need to, and the final retouch when she is already the swelling is left, everything can down, and you can see how no bruising even. Everything good. Why we are doing hydro profiling? Why we are injecting profiling with a hydro booster? Profilo, as you know, it's a high molecular and low molecular weight hyaluronic acid. Totally, it's 64 milligram hyaluronic acid, 32 low molecular with high molecular. It gives lifting effect. When we injecting the 5 points of Profilo, we give direct this lift look and you can see instant lifting. Also with the Profilo, you are playing on the depth. Why they are telling some people injecting Profilo there is no results and other doctor is a king of Profilo. Why patient tell that? Because the depth of Profilo is too much important. Don't inject Profilo in the fat. You are losing the product because in the fat hyaluronic acid will lose non-cross-linked. If the hyaluronic acid non-cross-linked, that means you should never ever put in the fat. You will lose the product. Cross-linked hyaluronic acid should be injected in the deep dermis. When you inject it in the deep dermis, you can see the direct lifting effect, and it will stay and continue for a long time. So we are injecting our patient with the 5 points of lifting with a profile in the deep dermis. If we add the making study, if we add hydro booster in the same session to correct some default in the face of the patient, don't inject hydro booster like a one way. Check the patient. Some patients, they are suffering from very deep nasolabial fold as it's cross-linked, soft cross-linking. That means if you inject it in the nasolabial fold, you will improve it. If the patient have a very sagging look and loss of volume in the cheeks, put it in the cheeks. If she have no jawline, put in the jawline. That means you can add the hydroposter to the profile to support the results by soft cross-linking product with the patient need little bit volume of filler, but they are not accepting that. Some people they get to know, doctor, I don't want filler, I don't want. Okay, I do not filler, but you need it. I can make in here in this time profiler because profiler profiler will lift it and the hydroposter will add a simple volume and simple touch of volume to some place to correct this place, and in this time you will get like glow injection, but amazing glow injection, long lasting. The patient feels big difference for a long time, and we are always look for glow injection make us happy in front of our patient, because sometimes glow injection, especially if the patient too much tired, I tell doctor, I just want glow injection. I don't want to add filler, no botox, no filler, I will not accept. Okay, how I give you a result by glow injection? Profile is a perfect choice in this case, because she will support the result too much and will give a very nice effect. Ashley, ready? Yeah.
Don't disconnect. خلاص لايف اسكلا
Yeah. I change this like this actually first. Wait. تفضلوا ناخذ بريك ولا تفضلوا نكمل؟ بريك؟ نكمل؟ كمل وخلصنا كثير احسن من بريك، بعدين بياخذوا مفتوح في التفسير. طيب. My patients, I'm fixing her face. Already she is my patient. Now, for profile row, we want to speak about that. Usually how we inject it, and in some cases how we can play with it. For the profile row itself, okay, 5 points, you follow the 5 points, perfect. But sometimes even you can give more caring for some point than another, because the patient needs in these points more amount than others. If my patient fully from here, no need to inject this area, I will inject the cheek more and the jawline. If again you have a big jawline, no need to, I will avoid this one. I will keep my material for so you can even play with the profile, give the maximum result for the patient, because this is 2 ml, you have it, you should inject 2 ml, you should give the maximum result. So you can follow the 5 point and you can little bit give some exception for 1 point for that. For the profile, the 5 points, as usually we know, the lifting 1, 2, 3, 4, 5. As we explained, the depth is the most important thing to keep in our mind. Now I should feel resistant. When you inject profile without any resistance, that's meaning you are putting, you are in the fat tissue. 0.2, 0.2 in the jawline, 0.2. You know, they are making study why do people feel more result by profile body on the neck more than even profile on the face. Why? Because they are usually injecting as much as they are injecting superficial. When you are injecting superficial, you get a very nice result. So no problem if you inject the profile superficial. And see, I see here blood, and I press a little bit, it's good. It's one crossing. So even I see a big bump, it's no problem. It will go. Again, this point, superficial, too much superficial, and this point. For the other side, easy. For profile, it's easy, but please film resistant. When you inject, film resistant, because you should be in the deep dermis. You should not go in the fat tissue and lose the product. Little bit is give lifting for the face, but the patient will feel more glowing and lifting after 1 week. Very easy. I like when I have patients for profile, I feel this is my brain. Easy to inject. And really, 5 points, that's really not taking time. 5 points will finish. See the blonde here? Little mustache. Nothing. Give me those, Ashley, please. Let's go. Now, for the hydro booster, when we add hydro booster, we can, if you want to take standard way how to inject hydro booster, go from 1 point here and make fan technique 0.5, fan technique 0.5. If you want standard technique. If you want to play a little bit by the product, put it where your patient needs a little bit volume. Jawline, nasolabial fold, upper cheeks, you can. Now we will do the standard technique for hydro booster by cannula, please. We will go by simple entry point here. I will inject by fan technique starting from the nasolabial fold. I'm right here. 1, 2, 3, 4. Like 4 line. Even it's cross-linking, simple cross-linking, but don't inject too much deep. Because it's soft product. To get best result, also inject little bit superficial to have a good result. I want you to see the difference between two sides. Is it clear? Just because we are injecting profile for the two sides, we're injecting, it's not clear as much the light is. Yeah, hydro booster adding. When you add this volumizing here, and it's so long lasting because it's a little bit cross-linking. It's also cross-linking, so it will lasting a long time. So it will give you, like as a glow injection, it's good result. Okay, entry point. Go for nasolabial fold. 1, 2. If you make it more or less, no problem. Sure, you can do, but usually we are injecting the upper face to give the maximum result for the cheeks to lift up. Profile body. Now she is perfect. Now we will transfer to profile body for neck. It's also supporting the skin. When the patient has these kinds of skin, like using skin, if we do for hair, profile body precision, within 1 month, applying the cream, it will help you too much to lift and improve the texture of the skin in this area. A profile body Also, too much easy to inject, easy product, but usually I start also by the corner of the jawline, because neck it's related and with the jawline. So if you improve the jawline, also neck will improve. So for this patient, if you want to give her the maximum results, start with the jawline. Start with this one. You give profile body here. You know the profile body is higher concentrated than normal profile, than profile face. Three times hyaluronic acid than in comparing with the profile face. So I start with the jawline, then I will injecting multiple points in the neck. Superficial point, don't go deep. You are more safe if you are superficial, and you give the good result if you inject superficial. Okay, and don't worry about this papules. It will disappear without maximum 24 hours, maximum. Again, starting with the corner of the jawline, give good support for this one, then go for neck. If the patient have these horizontal lines here, you can concentrate on it. As much you are superficial, you will give the maximum results and you will stay safe. Profile is not dangerous even you go inside the business because it's not crossing hyaluronic acid. I don't inject this area because here no need to add volume. If you want to improve even this one, especially this one, you can go to improve to lifting by the sides and avoid the middle area to let it give here heaviness, and to don't improve even the collagen here, which is maybe give a little bit adding volume with the time. Improve, but I'm afraid to inject this because even a little bit give you like thickness of the skin here. It's not good for the patient. Better if you lift it from here. You know, even when you're injecting hyaluronic acid, all the areas will improve as a hydrating and improvement. So not inject this one, especially in the middle. Inject like the border, you can lift better than if you're injecting in the middle. They are almost finished. Usually they are put with a profilo. They are putting patch, and you can follow the patch if you want. But anyway, you inject it. Profilo body easy, no rule, no instruction. You should follow it. Anyway, you're injecting. Just go for the good layer. Just be the true layer. You are true. Now we finish everything. Thank you for your attention and thank you for your being here. And really nice to meet you all. Hopefully, have a good day and have a good information about all the injections. And really, hopefully, we will see each other again in the coming course, inshallah. Thank you for all, and thank you to be with you today. And any question, anything for any time, I'm ready. Welcome to you, and really, I'm happy to see all of you today. Thank you. Thank you. We can apply for her the patch and the cream, as you know. They are sending with a box of profile with the patch. You can apply it. Make the redness less, the swelling less, and they are sending also the profile cream which the patient applies.